Well, we're gonna talk about back pain, and I'm gonna try and stop a few times and answer any quick questions you have. But most people have experienced this. There's a recent article, and I just happened to cut this out of the Griffin paper just 2 days ago. And back pain, pain in the back is widely overtreated in the United States. Okay, why did they cut on you? The shocking question came from a respected spine surgeon tracking Keith Svensson, who still had severe back pain despite an earlier operation. He didn't know what to believe. 2 other surgeons had recommended different operations. Svensson, who's from Minnesota, is far from alone. The only fraction of the people with back pain are good candidates for surgery. Complicated spine operations are on the rise. In a hunt for relief, by one estimate, Americans are spending $86 billion a year on care for your back. So this is a huge medical problem, and they've done things from MRIs to pain pills to injections to physical therapy to acupuncture. People are just looking for relief. The problem is patients think thinks medicine is so advanced that we can fix everything. And if you go back, way back in our history, they kind of warned us at the beginning, go ahead and stand up straight and you'll spend the rest of your life on backaches. So you have to be careful. It's partly because of our posture and our positioning that we start to have problems with our back. Again, $80 billion a year. 1 out of 14 patients see the doctor every year for neck or back pain. And that means about 33 million visits to the doctor per year. And we talk about universal health care and why it's so expensive and how do we avoid the costs of this, how do we avoid our own health care costs and try to make healthy choices. This is part of it. It's the second most common cause to go to the doctor, and most doctors, and I'm going to tell on the medical profession right now, most doctors don't know how to treat back pain. We're frustrated because we can't figure out what's causing the pain. There's so many things going on. And so we just start ordering tests hoping that something will point to the right direction. And all too often, we'll find a test that shows an abnormality, but that's not the cause of the pain. So a lot of my colleagues and my doctors are frustrated treating back pain, and so they will send them to me or orthopedic surgeons who have a little bit more experience with it. It results in over half a million hospitalizations, and that was back in 1998. Second most common cause of missed work. I mean, I've done several lectures with employers in the community trying to reduce back pain on the job. Trying to reduce back pain on the job. And through a simple exercise, stretching, maintenance program, some review of the workstations and ergonomics, which I'll talk about, we've been able to greatly reduce the number of back complaints there are at work. It reduces their costs on workers' compensation injuries and their health care costs. So the employer sees less time away from work, more productivity. The patients or the employees are less sick. So, I've done work at Caterpillar in Griffin, at Bandag, a lot of these places where there's a lot of physical work. And a lot of this started off in China and Japan, where all the factory workers were put through mandatory exercise programs, and it works. It really does. So 80% of all the people over 30 will experience back pain. Somebody said, come on, this is for old people with back problems. It's not just old people. Young people get back problems and back pain as well. And with a nation of sitters, and one of my handouts sits there is about sitting down. It's Are You Sitting Down, I think is the handout title. Kids are spending so much more time on computers and PlayStations and video games and all this stuff that they're not getting the exercise, and we're seeing an increase in back pain in younger people as well. Are you at risk for back pain? And my employers ask me, well, which one of my employees is going to get the back problems? When we look at that, we certainly know the people that are overweight are at a higher risk of back pain because of the increased stress of that weight on the lower back. People that don't exercise regularly, don't engage in recreational physical activity, just simply walking and going outside. And of course, smoking. And smoking does affect the health of the discs in your lower back and can definitely change the blood flow to the muscles and ligaments. So there's a definite correlation between smoking and back pain. And that's just another reason quick. Jobs that require frequent bending and lifting, twisting. The spine is good for loading. You know that little joke about stand up, you'll have back problems. Well, we're pretty good in loading, but if you try to twist and spin the spine, it goes through more stress. Kind of like those dough casings, where there's those Pillsbury dough, those roll dough things. But you can stand on one of those little jars of dough, and it won't collapse. But if you take it and you twist it, it pops open, and then you get the dough out. So that's just like a disc. If you twist a disc, it'll pop and separate. And things like lifting and carrying in a hurry. A lot of times the employers are pushing productivity and making the employees rush through a task. And when you rush through a task and don't pay attention to the ergonomics, then you'll suffer the risk of an injury. Pain in the back and pain in the lower legs, it can go down into the leg position. Now I'm gonna talk a little bit later about separating back pain from leg pain, because there are two totally different things. And pain that causes sleep problems, decreased energy, depression and anxiety, stress, amplifies the symptoms of back pain, and it can make things a lot worse. Seems to move about in different parts of the body, including back and then stress and emotional issues. Some people say my back hurts over here, and then it's sort of on this side, and it's up and down. And that's the hallmark of the muscular and ligament problems in the lower back. We call it mechanical low back pain, as opposed to something that's specifically wrong with a disc or a pinched nerve or sciatica. That throbbing, aching, it can be various things. When you come into my office, I have a little back diagram, and I ask you to mark on there exactly what you're feeling and where it is on the body, because it's one thing to say it hurts, but there's a stabbing pain or a burning pain, or it's numb here. And that helps us sort out just what exactly might be causing the problem. If it goes down one or both legs with very little pain in your back, these are symptoms of what we call radicular pain. Sciatica is a bad word because everybody uses it, and they refer to anything that shoots down the leg. But lower pain in the back, that goes down into the buttocks and down into the back of the thighs, we call sciatica. It does not mean that you have a pinched nerve, because muscle and ligament pain can shoot down and radiate down into the buttocks and legs. A pinched nerve or radicular pain goes down a specific path and a specific distribution, and often goes into your calf and all the way down into your foot. So once it starts to get below the knee, then we start to be really clued into that this may be more of a nerve pinch or nerve problem, and again results in leg pain more so than back pain. People have big ruptured discs with a pinched nerve, and they have no pain in their back. My back feels fine, but every time I move and twist it, it's lightning down my leg into my foot. And that's the radicular symptoms of a pinched nerve. Once it gets very severe, a bulging disc may push and pressure on the bladder and bowel nerves. And that's one of the few emergencies in back surgery or back treatment, is that if you lose control of your bladder and your bowel, and you don't know you had to go. It's one thing to say I've got a little stress incontinence, or I cough and sneeze and dribble a little bit, or I have to go and I can't get there quick enough. That's not what I'm talking about. I'm saying you're sitting and all of a sudden you're wet, or you've soiled yourself, and you didn't know that you had to go. One time's an accident, twice it's an emergency. You're on the phone to me or someone and saying, look, I've lost control of my bladder and bowel. Because if you don't get that pressure off those nerves quickly, within a day or two, then you could lose permanent control of your bladder and bowel. So that's one of the few emergencies that we have in back problems.